Hello and welcome back to my YouTube channel. Am I hypothyroid? I can tell you that if you are watching this video, there is a very good chance that you are. Now I know the next question that's going through your mind, how does Dr. Resnick know that I'm hypothyroid in just 20 seconds of a YouTube video when my doctor hasn't been able to figure it out for the last 2 years? So stick with me through this short video, because by the end I'm going to go over 3 important points that are going to give you great insight into your thyroid health, as well as an understanding as to why your doctor has been so reticent to treat your thyroid hormone. My name is Scott Resnick. I'm a physician and I'm making these videos to share with you all the tools, the tips, the techniques, and the understanding of health that I shared with my patients in my functional medicine practice over the past decade. So let's dive in. The first thing that I want you to do is to look at your thyroid health from a set of symptoms and established diagnoses. Because as I go through these symptoms and diagnoses, and as you get out your imaginary pencil and start checking off the boxes, the more of the boxes that you have ticked, the greater chance that these could be a factor of some degree of low thyroid function. So the common symptoms that I see in association with hypothyroid are fatigue, weight gain, and brain fog are probably the top 3. This is followed closely by some state of constipation or bowel dysfunction, and the vast number of people who are in a relatively hypothyroid state are also suffering from dry hair, dry skin, changes, cold hands, cold feet, and I can tell you that if you're one of the women who comes into my office and when prompted says, "Doctor, you're right, I am having some thinning in the lateral aspects of my eyebrows. In fact, I penciled them in this morning before my visit with you," you are in a state of hypothyroidism. But we have several well-established diagnoses as well that are strongly correlated with low thyroid function. Those diagnoses are depression, diabetes, cardiovascular disease, infertility, gastrointestinal complaints. All of these different established diagnoses have been strongly correlated with a low thyroid state. So the next thing I want to go over with you in this video is, why is it so hard for a conventionally trained doctor to make a diagnosis of hypothyroidism? And all of this heralds back to our first week in medical school. Maybe not first week, but early in our medical school training, we are taught that a hyperthyroid state, too much thyroid hormone, is associated with cardiovascular disease and arrhythmias, which are dangerous abnormalities in how the heart beats. And this is a true statement to a point. And it's only true to a point because it really is associated only with a state of hyperthyroidism that is commonly seen in a condition known as Graves' disease. And let me tell you, if somebody has Graves' disease, they get into a very hyperthyroid state. And yes, this can be dangerous. But this doesn't apply to a person who's trying to get their thyroid hormone into a functional and working range. We do not see changes in the pulse. We don't see any additional cardiovascular risk. The other fallacy that people are taught in medical school is that we can assess thyroid function through measuring what is known as the TSH, which stands for thyroid stimulating hormone. More than likely, if you're watching this video, your doctor obtained a TSH in the past, and if you're lucky, he or she did a free T3 and a free T4 as well, because only in knowing the TSH as well as the free hormones, in addition to the symptoms and diagnoses I mentioned earlier, can we know if somebody is in a relatively normal, low, or high thyroid state. So that brings me to my third point. What is the one critical step you can take to really understand your own thyroid function? Get the lab yourself. I recommend that you go to zrtlab.com, and the link is available in the notes below. You can order online a blood spot test that is going to tell you your TSH, your free T3, and your free T4, as well as a marker for Hashimoto's. You can do this in the privacy of your own home. Now, if your TSH is greater than 2.5, if your free hormones are in the lower third of their range, and you clicked any of those boxes that were associated with hypothyroidism, diagnoses and symptoms, you are hypothyroid. And I hope you can take this information to your doctor and begin to work with him or her to make some changes. Once again, I'm making these videos to give you good information. If you like this video, be sure to click, comment, subscribe. I'll be sure to respond to all your comments personally. And if you're interested in following up a little bit on this theme of hypothyroidism and how it relates to all aspects of health, most notably our cortisol function, I recommend that you click on the playlist which is being shown to you here on the side. I'll see you next week in another video. Be well and take care.